Hi, my name is Dr. Amy Jones, and I'm a physician with Mary Washington Primary Care. The fall season is usually a time for sports, but this year's return to the field looks a lot different for our kids because of COVID-19. There are things you can do to help reduce your child's risk of getting sick while participating in sports. In this video, I'll review these steps as well as the symptoms of COVID-19. I'll also talk about risk factors and when to see a doctor. First, let's start with the symptoms of COVID-19. Typically, most people with COVID-19 have a dry cough, one that doesn't produce mucus, and shortness of breath. They may also have a combination of at least two of the following: a fever of 100.4 degrees Fahrenheit or higher, chills, muscle pain, headache, sore throat, new loss of taste or smell. Some people with COVID-19 also experience stuffed nose, diarrhea, nausea, vomiting. Symptoms often start out as mild and can take between 2 and 14 days to appear. If your child has any of these symptoms, don't ignore them. Notify your primary care doctor and keep them home and away from others until they are feeling better. Typically, children with COVID-19 recover in 1 to 2 weeks with no issue. There are 3 simple ways to avoid getting COVID-19. Wear a mask that covers your nose and mouth, practice social distancing, and wash your hands often. Masks have been described by some doctors as the closest thing we have right now to a vaccine, and the latest clinical and laboratory studies show that masks help prevent respiratory droplets that spread COVID from traveling into the air and onto other people. Masks are safe for most people over the age of 2 and should be worn when people are in close contact or within 6 feet of one another, or when social distancing is difficult to maintain. The fit of a mask matters too. Your mask should cover your nose and mouth and fit snugly but comfortably. Remember to clean your mask regularly and wash your hands before putting on or after taking off your mask. I know that masks can be uncomfortable, but with practice, kids and adults can get used to them. COVID-19 spreads mainly among people who are in close contact within about 6 feet for a prolonged period of time. When an infected person coughs, sneezes, or talks, droplets from their nose or mouth are launched into the air and land on people nearby. Social distancing means that you keep at least 6 feet or 2 arms lengths between you and anyone who is not part of your immediate household. When it comes to sports and social distancing, there are clear challenges. Obviously, some sports like football require close contact between players, also known as prolonged interaction. These sports pose a greater risk of COVID transmission than those that have intermittent or incidental physical contact, such as soccer or field hockey. The safest sports are those with little to no physical contact, such as golf, tennis, and swimming. Hand washing helps reduce the spread of germs and is a very effective tool in the battle against COVID-19. It's always best to clean your hands with soap and water because it physically removes the germs. Hand sanitizers with at least 60% alcohol are great substitutes, however, when soap and water aren't available or practical. When washing your hands, there's definitely a right way to do things. First, wet your hands with warm water. Then apply soap to the palm of one hand and rub your hands together to make a lather that covers all surfaces of the hand and nails. Rub hands together for 20 seconds or the length of time it takes to sing the ABC song. Remember to rub well, this is what removes germs. Finally, rinse away the lather. We have much to learn about COVID-19, but there are proven ways to prevent its spread. By keeping these tips in mind, you can help ensure your child has a fun and safe sports season.